right, well, thank you, everyone. Good afternoon. My name is Christina Altmaier. I'm a Senior Vice President with HMA, and we're very excited to have you all. Thank you all for sticking it through. It's been a robust conversation throughout the day, talking about what's happening nationally, what's happening at the federal level, and the implications for Arizona. So I'm very excited that we have this afternoon's closing plenary session where we get to hear directly from the lawmakers in Arizona and hear their perspective. So please, a couple of just housekeeping items. We will have Senator Warner joining us shortly. She's running a little bit behind, so she'll be sneaking up on stage. But we'll have some informal Q&A, some conversations this afternoon with the legislators, and then we'll open it up to questions from you all. So we'll reserve a good 15 minutes, maybe a little bit more for you all to ask questions, so start thinking about questions that you may have, and then I'll come down and try and create that opportunity so we can all hear your questions. So please join me in welcoming Representative Selena Bliss, who is chairman of the Health and Human Services Committee for the Arizona House of Representatives, and Senator Sally Ann Gonzalez, who serves as a member of the Health and Human Services Committee in the Arizona Senate. So thank you both. Thank you both for making the time, and I'm not going to do formal introductions for them both. Their bios are in today's agenda packet. So I thought to get us started, if each of you could introduce yourselves and really talk about how your background informs your perspective on healthcare for the citizens of Arizona.
Must be alphabetical. All right. I get that a lot. All right, Selena Bliss from LD1, which pretty much is Yavapai County. Each year when we redistrict, our districts are reconfigured. And it's an Arizona revised statute that wherever Prescott lies of the 30 districts is always number 1. And that's the reason is we're the first territorial capital. So I love to throw that piece of history out since I lived in Prescott since 1971. My background as a healthcare provider is as a nurse. I worked at Yavapai Regional Medical Center on their payroll for 37 years. At that same time, I taught in the nursing program at Yavapai Community College. Now, some don't think I'm that old. I'm not like 109. I did that concurrently. I would teach during the week and then work at the bedside on the weekend. And what I could do as a result is bring the textbook to life in the classroom the very next week based on the experiences I had at the bedside. So I really valued that time as a bedside provider as well as a nurse educator. One thing I did to get ready for this position is I am one of the past presidents of the Arizona Nurses Association, and I was told I was one of the first rural educators, nurses, to be in that position, so I like to break the mold a bit. Want to do a shout out for Robin Schaefer. Raise your hand right here up front. Robin was our executive director of the Arizona Nurses Association for 10 years, and she taught me a lot. One of the first things she taught me is how to spell the word capital. Did you know it ends with O-L and not A-L? I didn't know that, so I'm really glad to be here. What informs my decision making the most is my time at a community college. I went on to get my doctorate thinking I was going to teach at a university. Never did that. I loved where I'm at with the community college, and the reason is I could see the immediate difference in supporting that workforce development, getting people to work, getting them independent, and career-minded. And then I was always pushing them to the next step. Go from your associate degree to your bachelor's, to your master's, to your doctorate. And to this day, I have students coming back and sharing with me their educational journey, and I think that's the best legacy I'll leave. So I'll stop with that, and looking forward to the dialogue today.
Okay, good afternoon. I am Senator Sally Ann Gonzalez, and I represent the Great District LD20 out of Southern Arizona, which includes most of the southwest part of Tucson, including downtown, the main campus of the University of Arizona, and my tribe, the Pascoyaqui tribe. And I am a teacher by profession. and that's what got me to the legislature many, many years ago. Not too many people know that I am the second longest serving current legislator in our legislature, and I've been serving in the Education Committee and in the Health and Human Services Committee. And the way I prepared or got interested in healthcare is that in 1972 to 96, in 92 to 1996, I actually was elected to the Pascoyaqui Tribal Council. And in that role, I was the oversight director for our health committee. And so we worked on a lot of health issues for our constituents. And we have a young tribe but for those of you who don't know, Pascoyaqui is one of the youngest tribes in Arizona that was federally recognized. We were only recognized in 1978 by President Carter. But we've been here forever, time immemorial, in the southern part of Arizona and in Sonora, and so we uniquely have people on both sides of the border, and so the border issue is a big concern for us Yaquis, and for me in particular. But during that time that I served at the Pascoyaqui tribe and was the oversight for the health committee, we really looked at the services that our members that are spread throughout Arizona and actually throughout the United States, but we have two big populations, the Tucson area, which includes 4 communities, Yaqui communities, and the Maricopa County community of Yaquis that include 3 Yaqui communities, but they're all over in Maricopa County, so the Yaquis live all over, but the biggest community is in Guadalupe, which is my home community, and where I grew up and where I live and stay when I'm in session, and so I'm very proud to be a community Guadalupana in here, Guadalupana. Anyway, but it really, I have to tell you a really quick story about how healthcare became one of my, as education was my first when I entered the legislature, and then healthcare became my second with the work I did with Pascoyaqui. But I'll tell you a quick story of how that came to be when we were looking at services for our community members. And for the longest time, well, this is the story. So the story is about this family from Guadalupe and how we were getting Yaquis were getting health services at IHS, but because we were Yaquis and we were new to that Indian health services, we were getting very basic services at the Phoenix Indian Medical Center, very basics, and so this one family, the mom had diabetes. I'm sure that was. Hadn't been looked at or diagnosed, and she went to the hospital. They went to the Indian Medical Center, and they filled out all the paperwork to get seen. And when they were reading the paperwork that they have turned in, they told her, "Oh, we're so sorry, we can't see you here because you are Yaqui. Your money goes to Pima County, so you have to go to Pima County to get your services." And so they put the lady in the car and they drove all the way to Tucson to the IHS clinic at San Javier, and they did the same thing. They filled out all the paperwork, and when they turned it in, the lady said, "I am so sorry, we cannot provide you service because you live out of the service area. You live in Maricopa County, and you don't qualify to get services here." And so they put the poor lady back in the car and drove back to Guadalupe, and And it's when we started working with the family and says, you have to go to Maricopa County. You are citizens of Maricopa County, and Maricopa County needs to provide services to you. But that's the story of what really became informed me, is that we really need to work as hard on providing health services to our members, no matter where they live. And so we work really hard with our federal delegation, and we now provide services in Guadalupe for our members, and we were able to do that because we were able to convince the federal government and our congressional people that it doesn't matter where our family lives, that our people need services, and they need to get it wherever they live. And so that's what really got me into the healthcare and be serving on the health committee, human health and services committee, and that and besides that story and what informed me is that our health is so important to all of us. I always run. When I run for office, I run on health care for everybody, free health care for everybody, because it is a right. To me, health care is a right, and we need to provide that. And so that's me. Thank you.
So I will start with Representative Bliss. Thank you again. Thank you for those introductions. So over the course of today, we've talked about a lot of different issues, from workforce, which you obviously have a deep background in, from access to financing to quality. What is top of mind for you as you think about where we are here in May of 2025 in terms of healthcare for Arizona?
Great question, and you're going to get probably a different view of the world from me because of being a rural legislator. We're outnumbered 2-1 down at the State House with the 30 districts. There's 90 of us, 60 on the House side, 30 on the Senate side. But for every one of us rural legislators is 2 urban or suburban legislators. So obviously access to care is what is most important to me, and I see it as this umbrella. And then everything falls under that umbrella. Is it board reform to peel back some of the redundant regulations? Is it workforce development? Is it policy? Is it technology? There's a lot of work under that umbrella, and that's what you're going to see as far as the bills that I encourage people to sponsor through our committees. One thing I want to point out, you made a comment, every state does this different, and I quickly realized we are 50 labs of democracy. If you look at the 50 states, no 2 states run their state programs the same. So it's interesting to interact with other legislators throughout the nation to see where is Arizona doing in this area as far as workforce development, or where is Arizona doing in this compared to the other states as far as other trends and data. The other thing I've come to realize as chair of Health and Human Services, and I learned this quickly by error, is that healthcare providers speak a unique language that we assume everybody understands, and they don't necessarily do. So what I've learned to do with those that are not healthcare providers that serve on our committee, both Republican and Democrat, doesn't matter, is we sat down early on in the session and we talked one-on-one about what are our goals, what are our priorities, how do we view healthcare, and that's when I realized some of the lay persons don't really speak the same language, so I have to slow down. We're not allowed to use abbreviations in our committee. We have to talk slow and not assume everybody understands every abbreviation. Our vice chair on the Health and Human Services side is a physician, so I thought that was a welcome to have another healthcare provider. So between the 2 of us, we have to remind ourselves, slow down, not everybody speaks this language. So where we're at right now as far as rural and even suburban and urban Arizona is we're looking at behavioral health issues are really front and foremost as far as if you look at the trends, what is most important, what deserves most of our time. So if you look back and watch some of the bills we heard in Health and Human Services, a lot concern behavioral health. I always invite you to watch us in committee and on the House floor. There's live TV. I call it the best daytime TV around. You can watch us in person or go and see the archived meetings, but you can type in a bill number and see what was the discussion or the thought process behind individual bills. So we heard quite a few on behavioral health. Aging services are a big deal for the district I serve. Coming from Yavapai County, and especially Prescott, I just found out the average age of folks in Prescott is 55. That's significantly older than the state average. And then we have Prescott Valley next door, our largest municipality, and they're the youngest demographic. So you've got that contrast. So aging services. I've been working with the Alzheimer's Association, and that's one thing you learn as president or past president of a professional association is you learn to lean on those volunteer associations or organizations where members choose to step up to join their professional association or join their association of interest, because that's how you have a voice as a collective group. So I pay special attention, and with the Alzheimer's Association, we sponsored House Bill 2133, I'm sorry, it's down here, House Bill 2182 to focus on strengthening the pre-screening criteria for cognitive impairment under ALTEC. See, I used an abbreviation. Arizona Long-Term Care System. So what we're looking at is as our population ages and we went into COVID, it was a dark period. We were losing some of our elders in the screening. And then we find out the screening tool is 20 years old and it's outdated. So that's been a good bill to run. It's not across the finish line yet. We're still out there working on these, but definitely between behavioral health and aging services, this is a priority. Again, looking at provider shortages. We still haven't completely recovered from COVID. Working on that still. Looking at costs, like you mentioned, access to services as well, and burnout in our frontline providers. So these are all things I can speak to personally, but with crisis comes opportunity, so let's put our heads together and figure this out.
Thank you. Well, there's a lot of concern that I have on a personal level, but for just the citizens of Arizona, from reproductive care to vaccines, vaccinations, and most, I'm really concerned about the possible cuts to Medicaid by the federal government. And so in my, access, our provider really takes care of 2 million people that are on Medicaid, and what are we going to do? What's going to happen to these patients if the federal government is, decides to follow through with their consideration of eliminating 95% of the federal contributions to the Arizona's expansion populations and replacing it with a standard contribution of about 65% in Arizona. This would really hurt everybody, all the way around, hospitals, doctors, but in particular, access to and we already spoke about access and having, access to medical services around the state. Rural, the rural communities have far less access than we people in the metro area and urban communities. Indian people and living on reservations like the Navajo, they have to travel hundreds of miles, some of them, just to get basic health services. And with the cuts that we are looking at possibly coming, we have to really, what are we going to do? What we, the legislatures, have to really work together as a body, nonpartisan group, to really pay attention as to how if that comes down, how are we going to do? Are we going to eliminate services? Are we going to have to it really it's reducing some of the things that might affect what we do, or our considerations might be lowering hospital and provider reimbursements, reducing or eliminating non-mandatory benefits, redirecting funding from other state programs, and raising state taxes to offset the funding losses. Those, in my community, a large percent of my constituents are on Medicaid, and so this is really a big concern, especially with people that have chronic diseases like heart disease and diabetes and all the complications that come with diabetes. How are we going to deal with these services and the cuts that are coming? With vaccinations, let me talk a little bit about vaccination. As a former classroom teacher, vaccination, and as a mom, it's really, vaccinations are really important to me. As a grandmother of 28 grandchildren that are in public schools, it's really disheartening to see that our herd immunity in Arizona is lowering because we have so many exceptions to vaccinations. And so it's a great concern to me, especially coming from a poor, I was raised in Guadalupe, like I said before, and my mom had 13 children, and I grew up with 11 of us, and I was the real middle child, 5 older and 5 younger. And the 2 other children that my mom had, they passed away from measles. And so vaccination and measles and all of that, vaccinations are really important to me, and I want to be able to protect kids and children in the public schools, in school. All children need to be protected, as well as foster care children that we, the state, are responsible for. Thank you.
Thank you. Thank you for bringing up vaccinations. It's something that I feel very passionate about, as well as we've seen increased cases of measles. And I think have just recently saw some of the data that was pretty frightening about the growth. And so if I may do a follow-up question, what do you see as some of the legislative priorities that are going to be taken up? We mentioned that we're, I guess 5 months into this year's session. Do you see some of these issues being taken up by the legislature?
You have to remember that I'm a Democrat and I'm in the minority, and so it's really that's where my take. And sitting in this committee, we've seen bills in this session that really are leading us to less protection on vaccinations, and vaccinations for not only employers and hospitals, with their employees, restricting them from making policies to vaccinating, having employees vaccinations for them so that they can protect their patients and themselves. Because as we all know, we have to be healthy in order to be able to help and take care of people that need our help, that are sick and need our help. But we also have so we have one of the things that I proposed, but my bills were not heard, is we proposed. I proposed reporting on vaccinations, especially for elders, because as I'm an elder, speaking of that, we tend to forget, we elders tend to forget what vaccinations we got in the year. And so if we could have mandatory reporting, this is not mandatory vaccination, but mandatory reporting, just like we do for children, it would really help our doctors. And it was actually my doctor who actually suggested that, because it would be very helpful for them to have that on their record for their elder patients who, like myself, forget which one did I get? What vaccines did I get already, and what do I need to get? And so to be informed. But let me turn the page to my vaccination sheet. Well, I hope that one of our stakeholder input on vaccinations, they really would like for us to look at protecting children, not only in the schools, but also, like I mentioned, in foster care, because we looked at bills. We looked at a bill that really prohibits DCS from placing a child in a home with unvaccinated foster parents or children, other children, and our stakeholders' input is that Senate Bill 1580 will interfere with DCS ability to ensure the health and well-being of more than 9,000 children in the foster care system. And so, aside from wanting, protection for kids, we really have to stop these kinds of bills that restrict the welfare of children, especially in schools and in the foster care system. So we hope not to see these kinds of bills in. And I'm not even sure where these two bills are. I know they both passed the Senate, but I'm not sure if they're back in the House, or if they're in the House, or if the governor will veto these bills. But that's what I have to say about what we need to see and what we don't need to see as far as vaccination bills in our state legislature.
Thank you. Representative Bliss, your thoughts about what's going to be top of mind as we go towards the end of the legislative session?
I have a shopping list, actually, but I want to address...
Please.
First, I just want to address vaccinations. This is something I was surprised. I'm on my second term. They're 2-year terms, so I'm on my 3rd year. And I was surprised to see a resurgence of the anti-vax movement. I'm thinking, well, follow the science, people. But again, we have a lot of lay people down there, and you have to speak slowly and use small words. So I'm just saying, one thing I'm passionate about as a bedside nurse is the concept of informed consent. So when people make medical decisions, such as vaccinations, do they really understand what they're choosing, whether to or not to vaccinate, and that risk-benefit ratio? What we teach our nursing students is show no bias. You have to offer informed consent, but at the end of the day, it's that patient's decision, or in this case, the parent's decision. So what I'm keying in on is education. Do these people really understand that risk-benefit ratio, and declining a vaccination, do they really understand the risk they're taking with their child's life? So something that alerted us, oh gosh, this was pre-COVID, when I was president of the Arizona Nurses Association, we collaborated with the School Nurses Association, and they gave us a heads up, and they said, hey, it's way too easy to opt out of childhood vaccinations. What's happening is the secretary or the administrative assistant is handing a paper to the parent, and they're in a hurry, and the secretary's saying, just check this box, you can decline, it'll save a lot of time. We were just like appalled that, first of all, that's not informed consent. Parents were not getting that reality of, is this risk higher, or is the benefit higher than the risk? So one thing we're passionate about is getting nurses in the schools, and my seatmate is Kwong Win. His wife's a nurse in the Prescott Unified School District, very large school. He sees it, he hears it. So we're looking at teacher pay. He is actively lobbying to get nurses at every school because he sees that risk of not having a nurse in the school. So just some comments when it comes to vaccination. So back to the question though, and that's legislative priorities. So I kind of alluded to some of my line items under that umbrella of access to care, whether it's delivery models, board reform, or looking at workforce development. Something I sponsored, House Bill 2133, short title is Nurses Provisional Licensure. Now this one was brought to me by the Arizona Nurses Association in that it takes too long for people moving to Arizona to get their license. So they're stalled, they're not able to get to work. So what we looked at is a provisional license through the Arizona Board of Nursing till all the checks are done. And mind you, we are, at the end of the day, it's all about patient safety when it comes to what the purpose of a board is. So we provided for that. This bill is still in progress. A lot's going on right now at the Capitol. We're winding down. This week we're hearing the last of the large groups of bills. We're going to go then into a dark mode, as they say in theater talk. I think the House is taking next week off, and the Senate the next 2 weeks, but it's not necessarily we're taking time off. We're going into rooms, we're discussing the budget, we're looking at the remainder of the session. So by Arizona revised statute, we're supposed to be out in 100 days. Well, that was 2 weeks ago. So we are into overtime. So when you hear, oh, they're on vacation or taking a break, not necessarily. For a lot of us, it means we're gearing up but a different type of work to come back and finish that budget. Some bills you'll see me sponsor quite a bit when it comes to access to care is compact bills. I believe strongly in compacts, in that a nurse or a physical therapist or a dentist or a dental hygienist, you name it, there's 22 healthcare boards in Arizona. If you're a provider and you're licensed in another state, if that state is part of a compact, you can seamlessly come, and we call that licensure portability. That's a new word recently. We used to just call it licensure reciprocity, where your license is acknowledged until you can get your change of address, but it doesn't delay people getting to work. It doesn't create these artificial barriers where it's money and time. The Department of Defense loves compacts because their military employees are coming to Arizona and their spouses might be a nurse practitioner, a physician assistant, you name it. They have to wait 30, 60, some cases 90 days to use their license to get to work. And that seems wrong to me. I like to, with our laypersons, equate licensure to your driver's license. You don't pay to have an application and money for every state you drive through. You have a universal driver's license in the United States. So compacts are similar where you can cross state lines, but you abide by the rules of the compact. Sometimes I just sit there and I think, what's the opponent thinking? I like to get in their mind, and this is one I could never really figure out. I think till today I had the aha moment. We had on third read on the board the dental hygienist dentist compact. And finally, one opponent got up and he said something about, I don't support this bill, it violates our state sovereignty. And I'm like, oh, just never would have thought of that. So it's important to understand your opponent, understand the language they speak, help educate to get those bills across the line. That one did pass. I think it's going to head over to the governor's desk. Yeah, we'll see. I sense a dentist, dental hygienist, lobbyist in the back. I don't know. Quick comment about lobbyists, too, now that I think of it. Some people think of lobbyists or advocates as a dirty word. I just want to say they're part of the team. They bring the subject matter experts to us, like the Arizona Nurses Association. They have their lobbyists. We work as a team, and this is where we put our heads together. We have stakeholder meetings. We bring in our opponents. We bring in our supporters. So everybody's important, and what's most important are you guys, the subject matter experts. Without you, we're just facilitators. We take your good ideas and we run with them. I'm learning so much. Other bills that I think are coming out of this session as a priority is looking at, here's again the role. HB 2134, looking at physician assistants and qualifications. My freshman year, one of my first bills I got signed was looking at the role of the physician assistant and how they collaborate with the physician. And we looked at that and we went to from a supervisory role to a collaborative role. And that's super important in rural Arizona, where you can get teams of physician assistants, nurse practitioners, whatnot, and that physician, and you have those teams to approach that collaborative care. A bill that failed was House Bill 2138 concerning access and naturopathic physicians. I believe when it comes to healthcare, it's all hands on deck. We need every type of provider we can get. So I was hoping to add naturopathic physicians to the list of what's contained on our state Medicaid known as access. This would have given consumer choice as well as reduced costs by including a lower cost provider. As we know, naturopathic physicians are not as aggressive with invasive tests and invasive procedures. They're a much more gentle approach, which I think some people prefer. So that's that freedom to choose. So we'll bring that one back. That's one thing about when your bill fails, you've planted a seed, just bring it back next session. Or find someone else to carry it. So, one thing when you sponsor a bill, you kind of have first rights to it. So if I look at someone else's bill and I think, gosh, that is the best idea ever, I'll go ask them, are you going to rerun that bill? Because if not, I don't want it to go to the wayside. But always respect that bill sponsor, that if it was theirs, it's theirs until they say otherwise. Here's one that just passed yesterday off the Senate floor. House Bill 2583, looking at physical therapists, looking at them ordering imaging and lab tests. We had to eventually strike out lab tests to get support for this bill, but what this does is it facilitates and streamlines that patient experience where you're not bouncing, like you said, from provider to provider to provider. If it's obvious you need an x-ray, you're seeing your physical therapist, why should you now have to bounce back to your nurse practitioner or your physician or physician assistant? So this is going to reduce cost, access to care, and better patient outcomes by early diagnosis. Talking about budget, so some bills to put in the budget box so that they can be negotiated. House Bill 2184, which I thought was important, but we all think our own bills are the best. So this one would have appropriated money for the Health Innovation Trust Fund to fund health innovation and healthcare workforce development, including entrepreneurial education, mentoring, and workforce programs. Those are tough, those budget bills. The word is out, if you're reading the news, we're barely above baseline of the $17.1 billion budget we have as a state. We're about $223 million above the mark. Now, last year, we were $1.6 billion below. Now we're above, but barely above. And each month when we release our finances, it's kind of bouncing all over. But I think we're going to cover some of that in an upcoming question, so I'll wait on some of what to expect from the federal government.
That is a perfect transition. Thank you so much, Representative. Yes, and maybe you already alluded to this, Senator Gonzalez, and I think it's been a theme throughout the day is what's on the horizon from the federal government and what are the implications for Arizona. So I know you offered some initial comments, Senator Gonzalez, so why don't we start with you and maybe what you see both as risks, which you started to allude to, but also are there opportunities? So,
Thank you. Thank you. I wanted to really highlight one of my bills, 1671, which is passed the Senate, and it's really in negotiations, and maybe we can get funding. We still get it through the finish line, but it's to traditional indigenous healing services to be provided and being an access covered service. And the group of indigenous physicians and community members have been working on this on a waiver for 10 years, and finally the CMS approved this waiver back in October, and I'm carrying the bill to make it, the states have to approve that this is a covered service, and so hopefully that'll happen. If not, I'll bring it back next year. I'd like Representative Bliss mentioned, my colleague, that we do run bills many years sometimes to get it through the finish line. And so, yes, I alluded to looking on the budget part. I want to be. I'm looking forward, and I want to be invited to that budget table. As Democrats, we usually are not. They are not invited to the budget table. I mean, we have our own little budget, and we have our ask and what we want to try to get in the budget and in the burbs, but we usually just get a budget, put in front of us, and we have 3 days to vote it down or vote for it. And so I really would like to be part of those negotiations on the budget and what is important to my constituents and to the majority of the Arizona citizens. But we do have to look at possible cuts to Medicaid and how are we going to do that. And it's going to be very important that we really put our heads together and work on what is the best way to deal with these cuts that are almost inevitably going to happen and affect your jobs, hospital rates, and more specifically the care of the people of Arizona, your patients. So I hope that we really take it seriously and all of us put our heads together to work on the solutions to these cuts that are forthcoming. Thank you.
Thoughts on the federal landscape?
Yeah, before I do that, I just want to comment on the traditional healing practices bill. This was brought to my attention last summer, and I really want to see that pass the finish line. This is another example of access to care. We've got choices, consumer choice, low cost, but impactful outcomes. We are known as a citizens legislature. We're considered part-time, so that we're supposed to go home and live under the laws we created in the first place. So it seems like sometimes we lose touch of what it's like to really be out in our districts. I also wanted to comment on the budget. That's exactly how the budget was handed to me as well. You're pretty much, it's negotiated between the governor's staff, leadership on the Senate side, leadership on the House side, and then it's handed to us. And like you said, we have 2 to 3 days to be a yes or a no. So it's very frustrating. As a freshman, I kept looking at some of the senior members saying, is this how they do a budget? And every one of them looked at me and said, no, we've never seen it done this way. So it's how the sausage is made. It depends on leadership. Every 2 years we re-vote for new leadership. They have a different style, a different approach. So I'm very excited to see how this new leadership team does roll out the budget. I think they're going to be more transparent in the numbers. They're basically telling us, you don't have anything, that we're barely going to make it. Now, having said that, what we're doing as our chair of appropriations is closely monitoring what's going on the federal level, and he's holding back somewhere to the amount of about $330 million. If the worst were to happen, Arizona does not want to be caught off guard. So money is being pocketed away for this October if the feds were to cut Medicaid and our state programs. We don't want to be caught off guard. So I do appreciate that conservative budget. But I also say this is a time for Arizona to get creative, and we're good at this when it comes to how can we look at patient outcomes with the lowest, best return on investment, let's put it that way. So what I like to talk about is prevention as far as how can we prevent people from getting sick? And this is the hardest thing to capture in a budget. It's what doesn't happen. That's harder to quantify, to say, look, we saved $1 for every 10 cents spent on this prevention program. I was with a group of insurers speaking, and I finally said, shame on you, shame on us. We're a nation of sick care. We invest our dollars in sick care. Why are we not a nation of wellness, well care? If we just did more to prevent illness, look at all the money we would save. Today, we had a bill on third read looking at obesity study committee to look at causes and treatment options for patients on excess suffering from obesity. That one barely got enough votes. There's a saying down at the Capitol, all you need is 16, 31, and 1 to get a bill across the line. And here's the importance of bipartisanship. You need that majority in the Senate, so there's 30. If you do the math, that's 16 votes. You just need 16 to get out of the Senate. In the House, we have 60, so you just need that 31, and then you need the governor to sign it off. So 16, 31, and 1. And here's where we depend on bipartisanship to support best ideas for Arizonans. And then, like you said, there's the partisan bills. I'm not sure what to say about those. I just sometimes, some days are worse than others. What can I say? So prevention, but also using the technologies we have. Look at telehealth. We've had a telehealth council. The Honorable Bob Burns came to me and said, I'm aging out, can you take over? I want to keep this going. I said, yeah, but we got to add artificial intelligence. We got to look at the newer technologies. We're not keeping up. So we've got a lot of work to do on telehealth. This will reduce costs and increase efficiencies and better patient outcomes. Home-based model care. I have a bill, second time I've run it. Actually, it's doing well. House Bill 2180, Acute Care Services. It's a pilot program. And what it does is there's a group of predetermined diagnoses like urinary tract infection that can be treated at home versus having to be treated at the hospital. But you still get all the therapies, the intravenous antibiotics, the diagnostics, whatnot. But you stay home, so less risk, better outcomes, less cost. So it's that thinking out of the box that will take care and guard our healthcare monies, I think, better. There's trigger words down at the Capitol, and one of them is, well, study committees, but anytime you say pilot program, some people, their eyes start twitching and rolling back. These are things you gotta help, again, folks that are down there that didn't necessarily understand that legislative intent of a bill to understand this is what I'm hoping to accomplish. For every $1 spent, we're saving $5, keeping people out of the hospital. So we'll continue that pilot program, get some more data, and maybe we can expand that. Scope of practice, a sensitive issue. People are very territorial. I did get passed and signed off about a month ago, House Bill 2025, medical assistants, looking at scope of practice, allowing them, and this was brought to me by the Arizona Medical Association, allowing medical assistants to insert indwelling urinary catheters. At first the bill said catheters, and someone said, do you mean heart catheters? I'm like, ah. So we amended that to specify urinary catheters. So sometimes you don't know how a bill's going to do till it rolls out. That's one example. But it's a success in that we didn't offend a certain profession, we didn't overstep bounds, but we expanded what medical assistants can do to free up the physicians and the nurses to, again, improve that access to care and better patient outcomes. So I guess what I really want to say is healthcare shouldn't be a partisan issue. I know in some areas it is. I tend to stay away from that. I figure we've got a little bit of time and a lot of work to do. That's why, as a healthcare provider, I'm very honored to be chair of Health and Human Services. I'm in my happy place. This is what I was always meant to do and where I've been meant to be. So if I do nothing else, this is it for me. So yeah, that's pretty much it.
Fantastic. I appreciate those positive words. We have about 10 minutes left, so I want you to reserve time for questions. I'm happy to bring the mic around if anyone does have a question that they would like to ask to our legislative panel. Feedback. I know there was quite a bit of robust discussions today around the federal policy and the implications for Arizona. Any questions?
Well, I have a comment.
Please jump in, and I'll walk down and see if anyone has a question.
While we're waiting, being a rural legislator, I am extremely concerned about our rural hospitals. If we were to see worst case scenario, the effects could be devastating on rural hospitals. So I'm constantly advocating for that, and very concerning. So there's a reason we're here and we're putting our heads together. So
thank you.
Hello to both of you. Thank you for being here. Representative Bliss, this is a little bit for you here, but one of the conversations we had today was about workforce data and how do we mobilize resources within the state to make sure that we're collecting unified and uniform data that can inform the decisions that we're making about how to assist with workforce development. Do you have any updates on appetite for workforce data, repositories, funding for those, models that could be used? We'd love to move that work forward.
Yeah, very important. We think alike because we're obviously both nurses, in that you got to have the data to assess the situation before you can make that diagnosis, formulate a plan, and then implement. So without that data, where do we go? We have access to quite a bit of data, and it's always evolving. You mentioned federal versus state. We are so laser focused on what's going on in the state. Every once in a while, I have to pull my head out and go, what's going on in Congress? Because we've got a lot of moving parts here, but it does filter down. So as to your point on data, we have federal data and state data. I do want to do a shout out. I mentioned earlier my seatmate, Kwang Win, and wants to advocate for nurses in schools. So we're talking to Matt Gress, Chair of Education, but Vice Chair of Appropriations, and we're negotiating with him, how can we get more nurses in the schools? And he said, well, give me the data. I need to know how many school nurses you have currently, what's their salary range. I reached out to the Arizona Nurses Association yesterday. I had it within 2 hours. So it's that kind of responsiveness, because I knew you guys had the data on the shelf ready to go. So for us, it's knowing our resources, utilizing our resources, where to access them. And again, back to you guys, you're the subject matter experts. Sometimes we have to ask you, but you can also offer that to us. You mentioned workforce development too as well, and I want to do a shout out for the bill we did a couple of years ago on preceptorships. Preceptorships, internships. This is what engages workforce to stay in the state, because where you're trained is typically where you stay. So anytime we can open residencies for our physicians, or preceptorships for our nurses, or internships for our healthcare providers, it's a win-win when it comes to workforce development. And there's Chair Werner. Yay!
Thank you so much. We wanted to offer an opportunity for Senator Warner to make some comments about, as we've been talking about healthcare here in Arizona and issues that are on the horizon. So,
well, first of all, apologies for being very, very late. Our floor time when we were voting today went very late, and we had a committee. We had to approve a couple of nominees, and my day was supposed to be done at 2 o'clock, and this is, Senate time. But I do appreciate you giving me a few minutes to speak. It was important for me to come here today to talk to you all a little bit. And I'd like to just put a positive spin. I have no idea what these guys have talked about, but you're talking about me. But what I do want to share is that in the state of Arizona, we really have to be forward-thinking, looking to the future, and what that looks like is we have to expand care, which means we need to get more doctors, we need more healthcare workers, nurses, the whole gamut. And I introduced a bill, which was signed by the governor. It was SB 1727, which now gives the medical schools here in Arizona priority interviews for our residents. So if a student is from Arizona and they meet all qualifications for admissions, they are guaranteed an interview at one of our medical schools. And I worked with the universities on that, and the goal with it is that ultimately that we build the bench so that we expand the amount of seats we have and we get more people that we can count on to be here. And the companion bill with that was SB 1623, which is for our GMEs, our graduate medical education dollars, and that's an appropriation so that we can add additional residency spots that are here in Arizona, because we know that if you do your residency here, you're more likely to stay here. And we're really trying to do that homegrown doctors, and we want to expand that into medical workers as well.
that is fantastic. Congratulations. Well, we are just about done, but I guess I would just offer to each of you maybe a minute or two to make any closing remarks, any advice to our audience, which is participants that in different ways are all working to improve health care for Arizona residents and citizens. So thoughts, any closing comments that you'd like to make?
Thank you. There's certainly a lot in the health arena to talk about. Please stay informed. Please, as Representative Bliss invited you to tune into our dialogue at the Capitol with these health bills that are being discussed and in both houses. I want to just really put a plug in for yes, access. The access to healthcare is what we need to be thinking of and working on, because if you don't have access to healthcare, then in all areas and all around the states, especially rural, the rural communities, it's dire, that our people, with the lack of access and support and transportation, will die. And so we really need to work on those as a body on providing and bringing all the help that we possibly can. Thank you.
You just reminded me of another bill. Speaking of transportation, I ran a bill on non-emergency transportation to get people to their doctor's appointments. That's a study that needs to happen because those rates are outdated and these folks are going out of business, but I digress. Because it's a money bill, it's going to be challenging this year, but we're not giving up. So I just want to say your voice matters. You're here. You're part of this. We're in this together. I do want to point out the value of the request to speak system, where you have an online account, either your business or your association or you as an individual. You log in from home once you've created your account and you weigh in that you either support or oppose or are neutral on a bill. That is very important to us. We look at that as a bill goes through. We look at its vote count. We look at who's supporting, who's opposing, and that helps determine our decision-making process. So don't think that's a small deal. The fact you're here tells me you're highly engaged on that political spectrum of people from all the way at the bottom where they just vote to all the way at the top where they actually hold office. There's a lot in between. And you're here, that tells me you're fairly high up that spectrum of political engagement. So kudos to you, and looking forward to what the rest of this session has to bring us, and thank you for having us.
Thank you. So I wanted to bring up two more points, and we had a conversation with a small group last night related to Medicaid and the cost of services for health in Arizona. And our high school graduation rates are directly tied to the cost of healthcare in our state. So our average graduation rate across the state is 77%. Pinal County is 88%. And in my district, where I serve on the school board, we're 94%. There's a little bit of a challenge that we're going to be taking a look at over the next few years to see if it has an impact. But while in my district we're graduating 94% of our students, only 50% are proficient in English and math. And where this matters is when students graduate or they don't graduate, and there's about 17,000 students across the state that do not graduate high school each year here in the state. They don't typically go into jobs that provide insurance. So then they end up going to the emergency rooms or they're not able to pay for the health care. So it's so important that not only are we working on expanding access to health care, but we also need to be working on workforce development so that our students that don't graduate and then go to college and take that career path, that they still have an opportunity to go into a workforce environment that provides insurance. And that way, the Medicaid gets less will be spent on people that are just not earning enough because they haven't had the potential to be able to do that. So it can really be spent on the vulnerable population, and hopefully it won't be so tight forever. So that's just something to think about as well, and we'll be working on. And I appreciate you having me here today, and I'm always open for questions. Feel free to email me, and like Representative Bliss said, request to speak. Let us know how you feel about bills. We do look at it, and we always appreciate the input. Thank you.
Thank you. This has been a fantastic panel. Thank you all for your insights. Thank you, Representative Bliss, Senator Gonzalez, Senator Warner, thank you so much for making the time. And thank you all for coming today. We want to again thank our sponsors for this event, and thank you all for making the time for these important conversations. And we look forward to seeing you next year at the State of Reform. Thank you.